Hello and welcome to Epi-Center. My name is Camilla Foy, and today I am going to be talking about the different kinds of seizures that are associated with epilepsy. Now, it is said that there are over 40 types of seizures, so I am going to go over the most common types. I would like everyone to know that in my research, depending on the country studies have been published in, there are different common types of seizures. In this, I have gathered the seizures that have been frequently mentioned in each source. If you would like to learn more, I am linking the sources I used in the description of this episode. Before I delve into the types of seizures, I would first like to outline the classification of the epilepsies. The International League Against Epilepsy established the terminology and approaches to classify seizures and forms of epilepsy. The classification of the epilepsies is used by healthcare professionals when they diagnose and treat patients with epilepsy. The latest update to this framework was in 2017. First, it takes seizure onset into account. Next, they look at the additional features. Lastly, there are expanded classifications. Now, I know this might sound confusing right now, but I will expand on each point as I talk about them. Seizure onset is the term to describe how and where in the brain the seizure started. There are three major onset groups: focal seizures, generalized seizures, and unknown onset. 60% of people with epilepsy have focal seizures, 30% of people with epilepsy have generalized seizures, and 10% have an unknown onset. Focal onset seizures, which are also known as partial seizures, start in one hemisphere or side of the brain. Focal seizures are divided into different types based on whether consciousness is impaired during the event. Focal onset seizures can be either motor onset or non-motor onset, which is a classification for if a seizure has a physical component. Focal motor seizures consist of these different types of seizures. Atonic seizures, which are also called drop seizures. These involve the sudden loss of muscle tone, which can cause the person having the seizure to fall unexpectedly. Automatisms involve involuntary repetitive movements such as tapping, pacing, or chewing. Clonic seizures consist of repetitive jerking or twitching. Epileptic spasms consist of sudden muscle flexion or extension. Hyperkinetic seizures involve limb and socket movements. For example, the person experiencing the seizure may rock back and forth, jump, or thrash. Myoclonic seizures consist of short, jerking movements from the muscle. These can resemble muscle spasms. Tonic seizures is when there is a sudden stiffness or rigidity of the muscles. Focal non-motor seizures consist of autonomic seizures, which impact involuntary functions. It can disrupt blood pressure, heart rhythm, or bladder function. Behavior arrest means that movements stop altogether. Cognitive seizures impair all cognitive function. And emotional seizures can alter the mood of the person having the seizure. They can also appear to be feeling a certain emotion without feeling it. Lastly, there are sensory seizures. This is when you feel sensations at the seizure onset, such as numbness, tingling, or smelling an unpleasant odor. General onset seizures occur in both hemispheres of the brain. They can have a physical effect, such as a fall or muscle contraction. Another type of general onset seizure that was mentioned in the previous episode is absent seizures. This kind does not have any physical movement. Those who suffer from general onset seizures can experience generalized motor seizures, which are similar to that of a focal motor seizure. These include atonic seizures, clonic seizures, tonic seizures, and myoclonic seizures. Lastly, there are tonic-clonic seizures, which are also called grand mal seizures. These consist of the sudden stiffness of muscles and repetitive jerking movements combining the tonic and clonic seizure types. These last for about 2 to 5 minutes. There are also generalized non-motor seizures. First, there are typical absence seizures. These occur when the person stops what they are doing and stare off into space. There can be abnormal blinking or eyelid fluttering associated with this type of seizure. These are usually short in duration, about 10 seconds in length. Atypical absence seizures are longer than the typical absence seizures. They contain all the same symptoms of a typical absence seizure, but there may be additional lip smacking and repetitive hand movements. The last type of generalized non-motor seizure is eyelid myoclonia, which consists of brief twitches of the eyelid. The last of the seizure onsets is the unknown onset. This is usually used to classify a seizure onset when no one was around to witness the seizure, and the cause is therefore unknown, or when testing has not been conducted and there is not enough information to identify the onset. I will also be listing different types of seizures that I wasn't able to confidently sort into the different onset classifications. First, there are gelastic seizures. These are focal seizures that involve bouts of uncontrolled laughing and giggling. A person may look like they are just smiling or smirking. Even though someone experiencing a gelastic seizure may look happy, most people do not feel happy. In fact, they tend to feel a sense of panic or anxiety, or even scared and at a loss of control. Dichristic seizures, which are often grouped with gelastic seizures, are focal seizures in which a person makes a crying sound. They may also look like they are grimacing. The emotions connected to these types of seizures are forced and uncontrollable. The person having the seizure cannot stop it from happening. During these kinds of seizures, a person is usually aware of their surroundings. These seizures happen in 1 out of 3 children and begin in infancy, the average being about 10 months. Gelastic seizures often occur when a child is falling asleep, but can really happen at any time. They can even be awakened by these types of seizures, but usually go right back to sleep. These seizures generally start with an aura, which is the warning sign that a seizure is coming. There can also be an unpleasant feeling in the stomach, tickling in the chest, or a headache. Most parents say that their children's seizures appear to be triggered by loud noises or fearful responses to sudden actions. These seizures can occur many times a day. One type of seizure that I would like to point out are psychogenic seizures, which are not related to epilepsy. These types of seizures are purely psychological and can be caused by things such as PTSD or some other psychological conflict. I do feel it is important to say that people with epilepsy do suffer from these types of seizures, however. I recently did a research project for an academic conference on mental health and bullying in people with epilepsy, and I found that there are many cases in which people with epilepsy enforce psychogenic seizures as a negative coping mechanism to deal with depression, anxiety, or bullying. I do hope to release an episode regarding more of this information on mental health and bullying in relation to epilepsy sometime in the future, and I will most likely elaborate more on psychogenic seizures as a coping mechanism in that episode. In the end, there are so many different types of seizures, and someone with epilepsy might not suffer from just one of them. In many cases, people with epilepsy experience different types of seizures throughout their lifetime. And the thing is, that is only scratching the surface of the complexity of seizures. As much as I would love to dive in deeper with the information out there, it would probably be a little too overwhelming to put in one episode. Hopefully, in the future, I can expand on this topic. In the next episode, I will be discussing the history of epilepsy. From the research I have already done about this topic, it is an interesting history and further proves why we should have more research and funding going into epilepsy. Please stay tuned for the next episode, and thank you for listening to Epi-Center.